Meet Rebecca Cherwanak. She's had heart problems for as long as she can remember.
I was born with a hole in my heart. It was patched when I was 5. That created a leak in my aorta. And when I was 23 years old, the leak got so bad that my heart wasn't functioning enough to keep me awake, and it was starting to decline greatly. So when I was 23 years old, they replaced it with a mechanical valve.
Along with the heart condition that was a constant issue all of her life, Rebecca also had something else for as long as she could remember: the desire to have a child.
I was referred by my obstetrician to Dr. Sue. He had a special interest in patients with heart problems that were pregnant. So when I met him, he was amazing. He is optimistic, realistic, and very caring. And he talked to my husband and I at great length, and he put everything in terms that we could understand. He took a lot of time and a lot of care with us, and he followed us through the entire pregnancy.
Pregnancy creates many changes in a woman's body and extra demands on the heart. You can imagine the additional stress imposed when the woman has a mechanical heart valve. Dr. Samuel Sue, Citywide Chief and Chair of Cardiology.
There's really no medication regimen that reduced the risk to the baby and also reduced the risk to the mom. A medication regimen that is the best for the mom is not necessarily good for the baby. So it was a very bit of a balancing act between a regimen or a treatment program which will also give the baby the best chance of having a successful delivery, and also reducing the stress or risk to the mother.
Carefully and constantly monitored by the team at London Health Sciences Centre, Rebecca was in excellent hands. In July 2008, Lillian Ann Mary Cherwanak was born.
I think that the cardiac care available at London Health Sciences Centres is the best in all of Canada. And I don't think that I'd be here without it. And I know that my daughter Lillian wouldn't be here without it.
And in just a couple of years, the new Grace Donnelly Women's Health Pavilion will open, consolidating all women's and children's care under one roof.
That will bring both the so-called regular risk and the high-risk pregnancy group together. And individuals such as myself who have a clinical and a research interest in looking after pregnant women with medical disorders are very much excited to be part of that move.